Hi, my name is Robert Albertelli. I'm the orthodontist here at the Center of Dental Professionals in Salt Lake. Both of our offices, Murray, downtown Salt Lake. A little about myself. I grew up originally in Southern California. Might seem like a strange place for me to come here since it's about 70 degrees colder right now than it is there. But I love the outdoors. I love to ski. If I'm not doing this, I'd rather be up there on the slopes. So I'm here to talk today a little bit about orthodontics, what we do, why it's important, and why you should come here and we can take good care of you. So first off, this is a case where you don't have to be an expert to see there's a whole lot of spacing in here. Everywhere, just way too much space. Most people think of braces with crowded teeth or twisted teeth, but this comes into play sometimes too, and this has its own challenges. But this is one we're actually currently treating, and we will have full expectation we'll get that completely corrected, all those spaces closed. And not just that, you can see how these back teeth maybe stick out a little bit too far. This side, maybe not quite far enough. So what we try to do when we treat is not just what you can see when you smile, which is probably, say, about that much at the most, but everything that's going on in back too, because the mouth, what's here is also connected to here in multiple ways. So if everything's where it should be, we're healthy teeth, healthy gums, healthy bone, and something that bothers a lot of people, healthy TMJ. If something's out of whack in back or in front or both, all of those things are thrown kind of into an upset and problems can ensue. Maybe not in the short term, but over time you'll get teeth wearing down, you'll get cavities in between the teeth, you'll get periodontal problems. People hear about periodontitis and gingivitis, and it's a much bigger problem than people realize, but bad alignment of teeth not just leads to that, but makes that problem worse and worse and worse over time. And then lastly, talked about TMJs. If things aren't where we want them, you can have problems in one side or both sides. Problems such as clicking noises, popping noises, pain is very, very common. And that thereby affects the bite, which then is like a vicious cycle as teeth start to wear more and things just get worse and worse. So here's a case where we're trying to close some space. So let me just minimize this, and I will take you to our next one right here. So this one is pretty unique. You'll see crowding and you'll see teeth that haven't come all the way in, but you don't often see one that's just not even close and it's not really blocked by anything. It's just not coming down. For whatever reason, that's where it is. So we then have to go in there and we say, okay, this tooth especially, this one to an extent, and somewhat here as well, we need to bring those down in line, more so with this, but not quite all the way there. That one's actually a little bit too far down. So we've got a little bit of a combination of too high, too low, up a little bit, down quite a bit, bring them together. Again, this is not just a cosmetic thing. Yes, it'll look nice, and we always want that. That's what most people think of when they're talking braces or any other type of orthodontics. But here, it's also a functional thing. When this hangs down too low, these teeth tend to chip. When this hangs down too high, this one can chip because you've got a whole other slew of problems. This is taking all the force, all the pressure, banging together, no help from the other side. So that's something we correct. We're missing a tooth back here. We've got a tooth that's very badly rotated here. So there again, yeah, let's make it look nice in the front, but we've also we've also got to tackle the issues in the back, make everything one nice cohesive unit, straight, pretty smile, also functioning, chewing, and that type of thing. So that's the story with that case. I'll show you one more here. Don't want to belabor the point, but we'll show you just this last one, another little bit of a different situation. So here, things are mostly in pretty good shape on the back teeth. Nothing sticking out too far or too far in. Basically straight, but one obvious problem, big gap in the middle. And not just that, if we could twist this up, you'd see that those teeth aren't just separated, they're actually flared out like this. Certainly not this far, but for purposes of showing you what I mean. So these ones, we need to bring them back in to the right angulation, because that makes a very, very big difference, not just in how it looks just to someone who walks by, but also can affect the lightness or darkness of the tooth, depending upon how angulated it is this way, facing straight out toward the lips. So that's one issue. The other issue clearly is let's close that space, bring that together. And then lastly, if this makes any sense, these teeth hang down, then it kind of goes up, and then it kind of goes down again. So we want to level all of that, again, for looks, for health of the teeth, bone, gums, TMJ, same old story. So to summarize, these are just a couple of examples. There are certainly others that are less complicated, and there are also, the other side, certainly others that are more complicated. But these are a couple of examples that will show you, hey, here are some issues that are out there in the real world. These are things that we can and should fix, and these are things that here at the Center of Dental Professionals we will fix for you. We look forward to meeting you. I do personally as well. Hopefully this has been helpful to you and piqued your interest somewhat in what we can do to give you a nice smile, also a healthy smile. Thanks for your time.